it's Bonnie Southgate here from Pilates Therapy at the Core in Ferndown. Today we are looking at a screen, looking at the function of the rotator or a couple of the rotator cuff muscles. So I just thought we would quickly go through the rotator cuff muscles, where they sit on the skeleton, and then we are going to get a real person down to show you the screen. So if we look at the rotator cuff muscles to begin with, we've got the infraspinatus here, which sits below the spine of the scapula, and then we've got our teres major and our teres minor. So infraspinatus and teres minor are your external rotators of the arm, and it's really easy to remember because they attach to the posterior part of the humerus. And then if we look from this view, we've got superior to the spine of the scapula, your supraspinatus, and that comes in and over the top of the humeral head. And then if we look at the anterior portion, and these muscles would cover the entire surface of the scapula underneath your subscapularis, which goes from underneath and it comes all the way across the scapula, and then it attaches to the anterior part of the humerus. And then you've got, not considered one of your rotator cuff muscles, but your teres major, which also sits on the scapula and comes through and attaches to the anterior portion of the arm. So the muscles that attach to the anterior portion would be your internal rotators, so your subscapularis and your teres major, and the ones on the posterior side of the humerus are your external rotators. So what we're going to look at is your infraspinatus and your subscapularis today. So we're going to have Maria in a minute coming in, and what we're going to do is we're just going to internally rotate the arm, and when we do this we'll be looking at whether the infraspinatus lengthens appropriately to allow that internal rotation of the arm. So we're really looking at the balance of the rotator cuff muscles, and then we're going to externally rotate the arm, and we're going to see that in order to externally rotate the arm, the subscapularis needs to be able to lengthen to allow that movement. So the shoulder girdle, or the shoulder in itself, is not a particularly stable joint because we need so much movement of our arms, and it is very dependent on the musculature. So if there's an imbalance in that rotator cuff group, then you can get problems within the shoulder joint. So if we get Maria to come over here, we're going to show you a screen for infraspinatus and subscapularis. Right, we've got Maria here now, so we're going to go for our screen for infraspinatus first. So we're looking to see whether infraspinatus is functioning properly, and if it does, it will allow her arm to internally rotate because it will lengthen. So I'm going to start supporting her elbow, and we're going to gently let her arm come into internal rotation. And what you're looking for is that arm to go through at least a 70-degree angle coming down, and for the humeral head to stay back, which it has done on Maria nicely. She's going to just show you what might happen if they have got either tightness or dysfunction in their infraspinatus. So as she brings her arm forward, you can see that the humeral head is popping forward, and that means that that arm isn't able to rotate in the socket. So you might then have to place your hand on that humeral head and then let the arm roll forward, holding it back, which might only let it then go to, say, about 30 degrees or wherever it goes. So that is a test for infraspinatus. And now we are going to look at testing subscapularis. So we're just going to take it in the opposite direction. So as you all know, subscapularis is an internal rotator. So in order to test it, we're going to take the arm into external rotation. And we're looking for it to come back to about 90 degrees. That would be normal, considered normal movement. And there shouldn't be any pain in any of these movements or any apprehension taking them there. So if her arm didn't go all the way back, so it came back to here, then she would have dysfunction in her subscapularis. And we've got lovely things called METs, which we use to deal with rotator cuff issues. And then, so in Pilates, if say she only came to about here, we might try and do an MET, and then we would strengthen her infraspinatus So using her reciprocal inhibition with a clini bend or something like that. So we go through these on your shoulder day or on some of our Pilates therapy days. The thing to also take into account is that the angle of the arm here will be testing her infraspinatus and her subscapularis. If I was to bring her elbow down here, we would be looking at the teres minor and the teres major rather than infraspinatus and subscapularis, which can be useful to screen them both because again it's the balance of those muscles around the shoulder joint. So really simple screen. Lots of people in class, if we can get both of your elbows going out to the side, a lot of Pilates teachers in class will have their clients taking their arms backwards and forwards as a shoulder mobility exercise, and so you can actually be screening your clients with an objective screen when you do those, and they won't know it, but you'll get lots of information about what's going on with the rotator cuff and the state of the shoulders. So that's a really quick, easy screen. We have lots more screens. We have special screens for injuries as well on our shoulder day. So if you found that interesting, you can find us on www.pilatestherapy.co.uk.